This video is to show how to use PT straps when managing bunion for bunion patients. First of all, bunions are a really common problem. Some 65 million people suffer from bunions every year. Currently, the ways we're managing is surgery, which is always a choice, but it's no fun. Of course, physical therapy, splinting, those kind of things. You might see out where a person, there you see selling braces. I have this brace on this particular patient right here. You can see the brace grabs the big toe and it does pull the toe over effectively. However, this brace, it would be impossible to wear with shoes. Virtually impossible. You can't, it's uncomfortable to put socks on. So what that does, it just limits the patient's ability to correct the deviation only when they're wearing the brace and only when they can wear the brace during the day. So you can't go to work. Even going to bed and sleeping with this thing on, patients find that it slips off. It doesn't really stay in place. It's a good attempt to try to correct it, but not as effective as we would like. You might also see in the marketplace lots of toe separators. You'll see the yoga toes that are pretty large, silicone, hard rubber that you put your toes on, which in effect, they do separate the toes. However, you can't really walk around in them very effectively. You can't sleep with them on as they fall off. And most of the time, those yoga toes are just one size fits all, but it's not really one size fits all, because if you're tiny, like say this patient, it's just going to be uncomfortable on her. And the nature of the bunions, as the toe deviates over, you have to gradually encourage the toe back into correct position, or it'll just cause pain. Okay, so I'm going to show you how to use PT straps in effort to start training the patient on slowly, gradually, basically pulling the toe back toward midline. So first of all, before we apply anything, I always try to get a good measurement of the toe deviation. This patient has a very mild deviation, approximately 15 degrees. Always, 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 before we apply PT straps, we want to use some alcohol wipes and wipe down that area as effectively as possible and let it dry. And that's going to secure better adhesion for the tape. All right? Now, what we're going to do is I'm going to show you on her left foot. I've already put a couple of dots for landmarks measuring the angle. And we've already measured it. So we're here looking at 15 degrees. So this is a mild, very mild case, which PT straps is going to be really effective for those mild to moderate cases of bunions. If it's severe, then we'd recommend you follow up with your physician. All right, so we're gonna apply one for the patient's left foot here. So we have the PT straps, normal PT straps. So I'm going to tear the paper backing right there in the center. I'm going to peel one side off. Okay, so what I'm going to do is I'm going to have this the length of the foot. I'm going to apply to the lateral side of the big toe and simply put the adhesive end down. It doesn't have to look pretty. You can just put it down on there. So now the PT straps is going along the inside of the big toe. So now I can hold, and I'm going to pull the paper back a little bit. And then what I'm going to do is I'm going to pull the toe over. Okay. So I'm going to pull the big toe and I'm going to take up the slack by pulling closer to her heel. Now, with all patients, we want it to be comfortable. So I'm not going to pull it over to where she has pain. I'm going to pull it over. It's a little uncomfortable. Then I'm going to back off a little bit. Okay. So once I find the spot where I want to take it, I'm going to pull on the strap and I'm going to secure it down on the inside of the foot. I peel the paper backing off. My thumb is holding down the strap so I know the toe is in position. And I put down the other adhesive side. And I give it a little rub on the other adhesive side. So in essence now, this is serving as a strap and is pulling the big toe medially, and you can see there's going to be a nice little gap. We can see there's a nice little gap in between the toes. And if we remeasure the toe, so we are now, in essence, we started at 15 degrees. So now we're at 8 or 9 degrees. So it's a gradual, very minimal direction shift. Patient's comfortable, and over time, we should be able to gradually move it over a little bit more as she's wearing it consistently. Some advantages we have using this is, compared to this, she can't wear shoes or with this effectively. With this, with the PT Strapz, she can put socks and shoes, any kind of shoes on, and go about her day normally. Good thing is, in the shoe, the toe is being deflected. So as she's walking, that big toe is going back into extension every step, but it's going to be in a better position. With the toe in a better position, it's going to help the capsular tightness and any muscular tightness that has developed over the time of it being deviated. So it's going to gradually help the joint and the underlying muscles that have been encouraging the deviation. So she can wear any shoe, and she can also go to sleep with this thing on. Okay. With the regular braces or the toe separators, those things fall out during the night. With this thing's not going to fall off during the night. She can secure it over and wear it all night, so that she can actually almost wear this 24/7 through the day, which is only going to reinforce improved correction of the toe closer to midline. Other advantages with this is it's waterproof, it's hyperallergenic, so it's going to reduce the irritation, potential any irritation that develops around the foot. She can shower, she can go exercise, work out, and get sweaty with this thing, and it's going to stay on throughout the day. Removing this is really simple for the patient. They just simply cut it and peel off the toe and off the foot and go about their day. Thanks for watching.